Counterpart is Ryan Gregoire, the Legislative Director of NYSAC, and I'm Dave Lucas. I'm the Director of Finance and Intergovernmental Affairs. So we're going to begin. If you have questions at any time, just raise your hand or throw something at us, and we'll try to respond if we can. So I just want to, the state budget, since COVID, well, since forever in this state, is up and down. It's a very cyclical spending. This is very dependent on revenues coming in, and there's been a tendency of the legislature going back decades. If revenues are high, they spend it all. And until recently, they built no reserves. I mean, their reserves were $1 billion or $2, and some of that was in segregated accounts for litigation. So as revenue came in, they spent it, and when the revenue dropped, there was no money to pay for a recurring program they developed. And that's been a pretty consistent model throughout. And then when COVID came, there was a huge influx of federal money, which in general, some of the counties got it. All the counties got something from ARPA, directly from the help of NACO and others lobbying for that. It was one of the first times that direct aid came from the federal government, like revenue sharing to counties. It was a huge lift, but it all sort of fell to the bottom line for the state as general fund revenue, and it worked that way for the counties as well. So we have this very cyclical pattern to the way financing works at the state level. And it's just historically, there's a lot of priorities, and when money becomes available, there's a priority that's been pending for a long time. They said, let's go for it, let's start doing it. And that's why you see in this first chart here, it highlights what happened at the beginning of the pandemic. The Division of Budget did estimates, and their 4-year projection was there's a $70 billion deficit out there. This was before federal aid came down. They weren't sure what was happening. You know, millions of people nationwide were being laid off. The economy shut down harder, especially New York, because we were first. And you'll see that just 2 years later, after the federal revenue came in, and there was a very quick recovery from COVID, and people probably weren't expecting it. They were projecting a $40 billion surplus, and they spent it all. All that money got spent for the most part. But one thing they did do this time that they haven't done in the past is they put money into reserves. So the state's sitting on a pretty big pile of cash right now, but the deficits came back again. Because as they spent money, the recurring expense, the recurring revenue streams weren't there. In New York, we're very dependent on Wall Street bonuses, and there's a lot of pay that comes through there. 20% of the personal income tax revenue that comes into the state comes from Wall Street, even though they're only 6% of the employees in the state. It's an enormous revenue producing place, so it's very cyclical in that regard. So you can see by July 2023, the deficits were back again. The $80 billion flip. You went from a $40 billion surplus to a $40 billion deficit. And then as another quarter passes, the deficit was dropping, mainly because PIT was picking up. 2022 was a pretty good year for the stock market. It went up quite a bit. We're in a really hot cycle right now. Depending on how we finished out this year. The only thing that's different for us right now as far as how the stock market finishes, on March 31st, the comptroller talked about it. He sets the return for the state pension fund. I mean, I think the NASDAQ is up 40% over the last 12 months. Now, he talked about it last night. We're not all in the stock market. They're only half in the stock market, but that's going to help. And if they have a high return, that means employer contributions could drop, which is a big expense for counties. So this was the starting point for the executive budget. In January, the budget came out, and she's projecting after all the things she wants to do in the budget, the governor, they're going to have a $20.5 billion 4-year deficit. The deficit before they started anything in the financial plan was actually $15 billion. And part of her proposals are to spend another $5 billion, which raises the deficit in the out years. I just want to highlight the big difference here. The blue bars are the mid-year update. That's how big the deficit was that they were projecting. That was in June. Actually in October, it would have been October. And then by the time the budget came out, the deficit dropped dramatically in the orange bars there. So it's a pretty big change. So what's driving it? We talk about it a lot, about they spend the revenue when it comes in on their priority programs. The priority programs for the governor and the state legislature, historically and still today, as far as general fund spending goes, is K-12 school aid and Medicaid. And these charts kind of highlight the growth we've seen since 2021. It's pretty remarkable. I mean, school aid's the biggest general fund expenditure in the budget. And it's targeted to grow by 44% over a 6-year period. Now, there were some big increases during COVID. There was federal money that went out. There was federal money that went directly to school districts, federal money that went to the state, and they really boosted it. Medicaid is the bigger issue right now. Spending is very much out of control in the program. It's nearly doubling in a 7-year period, and it's already 7 years ago, we were the biggest Medicaid program in the country. Not in total dollars, but on a per capita spending basis. And you can pick any one of 10 different categories of Medicaid, and we'll be in the top 1 or 2 or 3 in the country. I don't know if some of you went to the Medicaid session yesterday with Bill Hammond. Personal care expenditures, we spend more money in New York than all the other states in the country for that one program. It's an optional service. About 20 of the states don't even offer it. And those that do have a much lower per capita spend. So we're an outlier in many regards in the Medicaid area, and the spending is really growing remarkably. The biggest problem in Medicaid is there's been some program expansions. The estimates on growth and caseload have been, the spending is coming far greater than the initial estimates. And they also do a lot of cost containment within these programs, and the savings generated from the cost containment are not coming out as they had hoped. It's not entirely the state's fault, because there's a lot of federal money attached to Medicaid. So the federal government has to sign off any major changes you do. Another thing happened too during COVID is in 2019, in that calendar year, working on the 2020 budget before COVID hit, the state was entering another period of pretty intensive Medicaid cost containment. It was the second round of the Medicaid redesign team. And they had all these proposals in there. It was a couple $2 billion in savings over a multi-year period. So they had to submit a waiver to the federal government, and then COVID hit. And the federal government said, you cannot change your program going forward during the public health emergency. So all that cost containment got put on a shelf. So the state couldn't implement any of that. And the reason they did it is the federal government boosted the FMAP, which is free cash to the state. The counties benefited from that because we share in that. Well, we used to. We lost that last year. So they're kind of, those restrictions have been lifted going back about 9 months ago. So the state is kind of picking those things off the shelf. They're going to try to re-implement them, but they still need federal approval. So these things get stretched out, and it takes a while for the savings to show up. And as I said, these are some of the reasons why we've had problems. I think Bill mentioned it yesterday as well about the growth in the long-term care side of the equation. Caseload's far outstripping any estimates they ever did. The savings aren't being realized. And we're facing another problem here in this budget where the governor's putting $1.2 billion in savings on the table out of Medicaid in the current year. And even with taking $1 billion out of the program is still projected to grow by 11%. So that's pretty high growth considering you've been averaging 10% a year for the last 6 years in that program. And as you'll note in the slide here, there's $400 million in unallocated savings out of the $1.2 billion. they don't have a plan for it yet. They're going to work with the legislature, so they got to figure something out. Half of that is administrative, half of it they're saying we can do under statutory changes. And then there's another 400 million, which is really targeting the personal care side of the Medicaid budget that's really growing out of control. They really want to rein back in that program, these personal care, and a lot of it is related to family members taking care of other family members and getting paid for it through the Medicaid program. I haven't seen it, but someone said there's TikTok videos now saying the state will pay you to take care of your grandma, and they're out there, and they're pretty. It's just people are saying, "Oh yeah," and the program is growing like crazy as a result. Another problem we've had. I'm spending a lot of time on Medicaid, and I will get to the point in a little bit, but it's such a big expenditure in the budget, and we're so linked to it at the county level because we administer some of these programs. We do eligibility determinations for the state. Some of us have nursing homes. Some counties have hospitals. You're reliant on Medicaid reimbursement in those programs. So we can't get disconnected for it. And by the way, we spend $7.6 billion every year. We send to Albany for Medicaid, which is more than all the other counties in the country combined are required to spend for Medicaid. So this gets built into our tax base, and it becomes an affordability issue, and it really is the gorilla in the room right now, and it's out of control, which is a big issue. Something that's been lacking the last few years considerably, and a lot of the good government groups are in the same boat. The Citizens Budget Commission, the Empire Center, Bill Hammond was here yesterday talking about it. You can't get clean data from the state anymore on what's going on in the Medicaid program, or at least we feel we have a hard time figuring out. We've reached a point where many of the counties here, starting with the EF map, started foiling the state saying what's going on. We just recently foiled the state in the fall for the COVID-related information. They asked for an extension because they were searching for the records. That extension ended last 30 days ago. We're going to have to go back to them and see what they can find. We know the information's available because they sent it to every county commissioner, got a letter or an email saying this is what your new weekly share is. That's what we were asking for. So not seeing what's going on, it's hard to figure out. I mean, going back to 2019 under Governor Cuomo, he forgot to tell the legislature that they were running $1.7 billion over in the Medicaid program during budget negotiations. It came out in a footnote in the quarterly update after the budget was adopted. So I give credit to the governor, who in her budget admitted we're overspending by $1.5 billion this year, and that's part of the reason they're trying to cut out $1 billion. So this chart is just it just shows what happens when the estimates are off a little bit. So that top line there is showing that's January 2023 when the executive budget came out. So they're saying over that time frame, over that 4-year period, Medicaid was going to grow by 38%, which is a pretty big increase because you see that 12 and 15% increase there. That was kind of during COVID and the expansion. You couldn't take anybody off the rolls. It was another federal rule that once they were on, you didn't check eligibility again. We are doing that now. We're cleaning the rolls up and checking eligibility again. And not as many people are going off the rolls as they thought would go off the rolls. So that's keeping this number higher. But in January 2024, now, because those estimates were off, the growth is almost 60% over the same time frame. So being off a little bit makes a big difference in a big program. So we have concerns about that. And I'll just go back for a second. And the big reason I spent so much time on Medicaid is because we're a payer of it, and we pay a lot. It's a huge amount of money. We currently, that $7.6 billion we pay, I mean, all the county officials know, it's capped. Supposedly we don't go over that amount because the state has capped it. But if the program keeps growing at this rate, at some point the cap's going to be breached. They're going to say, well, your 7.6 is going to be 7.8, then it's going to be 8 potentially. because they need more resources. They're trying to control the costs, but it's going to be really hard to control the costs in that personal care program, because you're talking about family members taking care of other family members. And it's going to be difficult to say we're going to basically cut that program back dramatically, because the horses are out of the barn and they're out there. It's going to be really hard to do. It's a hard policy call to make. So it's unlikely they're going to get the savings they can achieve at the end of the day. Part of what's going to happen in the negotiations this week, there is a revenue consensus forecast. The Senate, Assembly, and the governor's office will be meeting this week. They'll determine, is there extra money available? Is there other avails where spending is not going to be as high as they expect? And I would suspect they'll find anywhere from $500 million to $1 billion that they'll add to the budget, and then they'll change some of these things. Well, maybe we don't need to take $1 billion out of Medicaid, we'll do $600 million instead. Something more concrete or doable. So that's kind of the backdrop, the big backdrop on the financial plan. And I have to say, in the context of a $230 billion budget, a $19 billion deficit or $20 billion deficit over 4 years is very manageable if you can control costs. And that's where they've been struggling in recent years. They have $19 billion, $20 billion in reserves. They just added $500 million, or they will before the end of the year. So they have a little over $20 billion in reserves. None of that money is dedicated to fill any of the gap going forward. They plan to control that gap by spending and revenue actions, which is great. I mean, they want to keep it as an emergency pool. The comptroller talked about it last night. It's for the first time in a very long time the state has had reasonable reserves in case of an emergency. Overspending. We're not really in an emergency situation right now. We shouldn't be in a $20 billion surplus situation. It's a little bit management. It's desire. There's only so many resources. There's a lot of priorities. But we don't have like a recession in the economy. The stock market hasn't crashed. Actually, it's grown. So it's sort of a self-inflicted wound to some degree, but they need to work through it, and they have a lot of resources available. So with some good cost containment and spending controls, a $20 billion deficit over 4 years is very manageable. So against that backdrop, this is the governor's proposal in the backdrop, and we have the economic conditions to consider. So what are people talking about? This slide is what economists were thinking in the summer of 2022. What was the chance of a recession nationally? So the top is, you had a lot of big economists and firms saying it was a low probability. And we all know these firms, Deloitte, Morgan Stanley, Citigroup, they were in the very low probability. If there was going to be a recession, that train has already left the station. That's the imagery I'm trying to show here. So there was another group that said there's a decent chance of a recession. So to me, Tiger Woods lining up a putt, there's a decent chance he's going to make it. Others it was a toss-up. It's 50-50. We're not sure. It could go either way, depending on what's going on. And then you had the others that say, absolutely, we're going to have a recession. It's a slam dunk. But it never happened. State DOB was in the same bank here. They were in the absolutely, we do think a recession is going to happen at some time over the next 12 to 18 months. And that was kind of what most economists were saying. Sometime over the next 12 to 18 months, we're going to have a recession. Today, it's a little different. Most economists have fallen off that. Excuse me. Goldman Sachs is, I think, down to a 15% chance of a recession over the next 12 to 18 months. That's pretty low. We have issues. The thing that will probably force a recession is some sort of global geopolitical issue. They've got two major wars going on right now. Anything could go very badly and affect the economy in those areas. The reason I put this chart up here is that in 1 month, the feeling by a lot of this is a survey of economic advisors that Bloomberg does they do it monthly, and I think they interview 70 or 80 economists. And in January, you can see what they thought GDP was going to be for the coming year and consumer spending. And the red bars on the other side are showing, in February, they really are feeling more positive. So we have this backdrop where potentially the economy is not going to be a hindrance hurting, at least on the revenue side, or a recession that would hurt revenues for the state. Now, we're very reliant on Wall Street, so if Wall Street doesn't have a good year, that will impact revenues. So the other factors you're going to look at, this is a chart that shows, it blends together all the different economic indicators. And the yellow line there is New York State. We're higher on a lot of these issues compared to the U.S. as far as whether a recession might happen here. And that's just part of, the next slide I'll get into part of the reasoning for that. This is tracking employment in New York State. Obviously, people need to have jobs. We have very low unemployment rate in the state and nationwide. It's historically low over a long period of time. So that's a good thing. This slide shows how many jobs have been recovered since COVID. And the yellow line at the top is the U.S. So back in 2022, the summer of 2022, nationally, all the jobs lost in COVID had been recovered. The other three squiggly lines are New York City, New York State, and rest of state. The only entity in New York State that's recovered all their jobs, and they were a laggard before, was been New York City. So they think they've recovered their jobs, but they're sort of flatlining around that number. The rest of state, that gray line, it's hard to see up here, is still lagging. We still haven't recovered all those jobs. The state estimates in the budget that it could be as late as 2026 before those jobs are fully recovered in the rest of the state. DOB is pretty positive on consumer spending, that real spending will continue to be good. A big reason for that is there has been pretty strong wage growth, especially at the lower end of the working sector. Leisure and hospitality, restaurants. Restaurants still haven't caught up, as the comptroller talked about, as well as recovering all the jobs. But wages have gone up quite a bit in those areas. Right now, for the last 6 months, wage growth has been exceeding both inflation measures, the core and the overall CPI. So that's helpful. It helps consumers to keep spending. But the weight of inflation is still out there. We had these 6, 8, 9% year-over-year increase, but we never dropped 9% in a lot of those categories. Maybe in energy we did a little bit, but the weight is still being felt by the consumer because everything piled up. So in this context, the governor puts her budget together, her deficits, and these are her priorities. So she wants to maintain the spending she's done in K-12, but at a much slower rate. So they had to build up for foundation aid. Those are really big increases. She wants to continue in Medicaid, again, but curtail the growth, mainly on the long-term care side. She wants to continue migrant assistance to New York City for another year. That was only budgeted last year for 1 year, so she did about $2 billion last year, a little over $2.5 billion this year. There's some small investments she's doing on the public safety side. Some of that would come down to the counties. And of course, she still wants to build more housing. More carrots, less sticks is for what we're going to try this time. Excuse me. So, why does it matter to county? So there's a lot of things in here that are helpful. It's not like last year. I mean, we kind of got crushed last year when we lost the federal Medicaid money. So there's really no major new significant cost shifts in this budget. There's little ones here and there. You have to deal with those. There's a proposal to modernize the sales tax in the vacation rental industry. I think their estimates are low. They're saying maybe $6 million in new state sales tax. I think that's based on an initial survey. I've got data from 20 counties. I think it would be easily $30 million in more state sales tax. Excuse me. The governor's proposal on in-rem, which was forced by the U.S. Supreme Court decision last year, is workable for counties. It's not perfect. We're going to have increased losses for those counties that do keep their surplus now. But the legislature wants to go in a different direction, and we'll talk about that more later. And there's a variety of pots of money in here for counties that weren't there before. Some for 911 expansion, some money that's meant to be sort of for housing and spurring some housing development, just some money in there. Not usually something counties do, but we're going to get in there. And there's this other list of items here. Ryan's going to talk more about emergency management services in a moment, but there's a lot of things in the budget. This, again, not a typical county function, but other entities aren't able to carry it on anymore. So they're going to have to, the counties are stepping in. And that's a very expensive proposal to do. Oh. So like I said, even though NREM's in the budget, it's workable for us. The legislature wants to go in a different direction. It's still going to cost counties money over the long run. When we kept the biggest reason is when we foreclose on a property, for those that don't realize, we pay the school tax and the town tax that didn't get paid to the town or the school district. And part of the reason we kept surplus and charge interest was to backfill those losses, so we could maybe break even at the end of the day. Without surplus, those losses are going to grow, and there's no way around it. The Supreme Court has spoken, and that's the way it's going to work. State spending, as I indicated, is on an unsustainable path. And at some point, they're going to need to find revenue if they don't get their costs under control. There is an interesting proposal out there. They wanted a constitutional amendment to lift the number of Supreme Court judges in the state. That is capped at about 400 today. So they want to lift the cap and appoint as many as they want or as necessary to clean up the courts and make sure we can get through the court process faster. The problem is counties are responsible for building the space for each judge. Chambers for each judge is about $1 million, not including court space. So if you hire 100 judges, that's $100 million in capital. This will be a constitutional amendment, so it has to go on the ballot. But that's sort of a sleeper thing out there. I'm not saying we don't need more judges, but we have to pay for that under state law at the county level. The NREM, it's in here for your information. I'm not going to go into a lot of detail on what it does, but it works for the state. The key point here is the legislature wants to go in a different direction. They want to rewrite real property tax law, and they're not as interested. They have to deal with Hennepin, but that's not their priority right now. And this kind of gets into the second half of our talk about advocating for county priorities, and something we started working on last year. I'll go through these quickly, and Ryan's going to pick up the rest of the discussion about how much money we spend on behalf of the state that goes directly into the state, but it's never recognized in the financial plan. Last year, this is when we lost the revenues, the 57 counties lost almost $600 million on a recurring basis. So some of it was administrative actions, foster care rate increases that we had to pay for. I'm not saying these things didn't need to be done, but the state could have kicked in some support instead of saying you pay 100% of it. They did kick in a little bit on ATB attorney rate increases, things like that. But $600 million, that's 11% of the outstanding county levy in that year. When our reserves are tapped, we're going to have to go to the tax levy at some point, or reduce local services. So at the end of the day, we'll send about $14 billion in locally raised revenue to the state. The $7.6 billion for Medicaid, safety net's a big one, paying for indigent defense, preschool special education. So that $14 billion really adds up. The financial plan for the state does not work unless we're paying for or putting that money in to begin with. But it's not lined out in the state budget at all. It's not recognized. For social services, counties pay 100% up front, and then we get reimbursement from the state for their share. So that's what they budget. They budget their share. They don't say we put in X. We know we did, but I think a typical taxpayer out there doesn't know how much money is raised locally, which is not done in most other states. And it's part of the reason our local government taxes are so high, or combined taxes. And this is an example of what one county did last year. They just kind of lined out, this is what's happening in my budget. These are the changes. We have a tax cap at the county level. You know, the state mandated changes alone were 3 times the allowable growth cap for this particular county. So we encourage folks to remind their state representatives and the executive's office of the impact, the weight that we feel from all these mandates. So I'll turn it over to Ryan.
Oh, thanks, Dave. Thank you, Dave. So, I think Dave really set a good foundation to think about why it's so important to advocate for your county and advocate for your county interest. Just by a show of hands, how many folks in the room have lobbied their state representative? You've either gone to their district office, gone to Albany. Okay. How many folks, and there's no reason to feel ashamed, how many folks have not done that yet? You haven't met with them in the district, haven't met with them in Albany? Okay, a couple hands, great. I'm looking at County Executive polling cars in front of us, who is I would say one of the experts here at the county level in doing that, and County Executive Serino, who was on the receiving end of those meetings. Just by a little bit of background to give you some context, right? I had worked in the legislature, I worked in Congress before working for a county and then coming to NYSAC. On any given day, right, in a state legislator's office, I was a legislative aide. I had 15 or 20 meetings on my calendar. The senator or assembly member had another 15 or 20 meetings, and their chief of staff or ledge director had another 15 or 20 meetings. So think about that for a second, right? When we are meeting with our state representatives, they're being constantly bombarded with information. Okay, so, we here at NYSAC advocate globally for county priorities. You do it at the local level, but it's a conversation that can't be a one-stop shop, right? You have to continually be engaging with your state representatives to get your points across. So a couple resources that we have at NYSAC, right? We put together our annual legislative program. And in January every year, the NYSAC staff heads up to the LOB, heads up to the Capitol. We deliver a print copy to the lawmakers. And NYSAC is here for us to help you with all of that. So again, we'll make this PowerPoint available at the end, but here's a snapshot of what our legislative program looks like and some different resources that you can go to. All right, this slide is really, really important. Again, I just mentioned how many meetings these folks are flooded with on a daily basis. It's the constant communication and reminder and follow-up that is critical. So if a state senator asks you, can you get back to me with data on X, Y, and Z, or how much is early intervention going up in your county? You've got to make that return communication back to them. You have to give them those resources because that helps build trust, and it also helps empower them to go to their leaders to advocate for what you've asked for. Okay? So again, thank them for the meeting, provide them support if they've asked for it. I wanted to take a moment to highlight an example this year of a really strong advocacy campaign that NYSAC launched. So earlier this summer, we brought together a coalition of nonprofit, for-profit EMS providers, municipal EMS providers, members of the various hospital associations across the state, and state legislators who had a passion for dealing with our emergency medical services, which is really in crisis across the state. I've heard from, I think, just about every single county. Most counties at this point, as Dave mentioned, historically, we haven't really had much of a role in EMS. However, that's changed. In the last 5 years, many of your counties are now either supplementing EMS services, or they are providing it directly through the county workforce, or some combination thereof. So we brought together a coalition. We launched the Rescue EMS campaign. Okay, and we had 15 members of the state legislature. It was a bipartisan group that joined us at this press conference to really highlight this issue. So fast forward to January, right? And actually even prior to January, you know, we start meeting with the governor's office, with the Division of Budget to advocate for our county priorities. One of the issues that we brought up was you've got to take a look at EMS. We've got to create some stability out there for the counties and for our municipalities. And the governor and her team worked really closely with us to develop a proposal in her budget. Now, is it the silver bullet? Absolutely not. But our campaign, which our package is online, is not the silver bullet either. But it's a step in the right direction. So together, we built this coalition. We created a platform, essentially, of EMS proposals that are endorsed bipartisan support across the state by counties. And we've gained some traction here, right? But again, I want to reiterate that it's not just that one point of communication. It's got to be constant. Our social media team at NYSAC is all over Twitter and Facebook reminding folks to take some time and pay attention to the EMS crisis. And we develop these resources to help you advocate locally with your members and your delegation. At the end of the day, right, I mean, our goal is just to make your lives a little bit easier, whether that's dealing with the state budget or with policy matters. So, you know, I think we've gained enough momentum in the state legislature, as long as we, you know, keep the gas pedal pressed to the floor here, that we're going to see some change in this program. And we did this, you know, a couple years ago with the internet sales tax. So, you know, this is just an example of one area, a case study, if you will, in advocating for your county that we wanted to bring up. And I guess with that, Dave and I will be happy to take questions on budget, advocacy,